The Limpopo Health Department is cancelling contracts of more than 150 community service doctors. These include some of those sent to Cuba to study. 450 nurses and other affiliated workers will also be laid off. This as the department faces dire financial constraints. It's alleged other provinces are also faced with similar issues. For more on this, I'm joined by Health Minister Zweli Mkhize. Dr. Mkhize, thank you for your time this morning, coming to us from our Durban studios, I believe. And I want to start off in Limpopo. Can you confirm that these 150 doctors and some 450 nursing staff and other affiliated health workers are in fact being laid off due to financial constraints?
Well, let me first explain how the system works. It works on the basis that you get placed on a statutory compulsory level on a community service post or internship post. Once that period has expired, then your contract as a community service doctor or nurse ends, and therefore you need to be placed in a different post, and those posts may be available in the same hospital, same province, or different hospital in a different province. So it does involve that people have to do applications afterwards, and also it depends how many posts are immediately available in that particular area. So what we are now looking at is that there's a number of posts that are going to be vacated so that we can place new community service doctors. Then the doctors who need to be placed on permanent employment, we're working on all of those to be able to be placed. The challenges that some of the provinces are facing is that there have been financial constraints, such as in Limpopo, but that matter has been brought to our attention. So between myself as Minister of Health and Minister of Finance, we're actually solving those problems. As far as we're concerned, no doctors will remain unemployed after all of this work has been done. Just that the numbers are much higher this year. For example, interns from last year, we were about 1,300 or thereabout, but this year we're taking about 2,300 interns. So the placement of those meant that, there's a lot of rationalization that needed to be done. We've finished that now. We're now placing community service doctors. That is now finished. We're now dealing with the medical officers who will have to move to various hospitals. We can only urge them to look out for adverts coming from various provinces, because they might get a post in a hospital that's away from the hospitals where they served before. But I just want to assure the medical officers that they will actually be placed. It's just that the processes are taking a while, because there's quite a lot of rationalization that that we're going through right now.
Dr. Mkhize, so we know that there is a shortage of doctors in many provinces, and to that end, the government funded for certain medical students to go to Cuba to train as doctors. Surely it would be a great loss, both financially and in terms of skills, if those doctors do not get placed. I hear that you are assuring us that they will get placed, but if financial constraints are as serious as they would seem, how will the funding be found to re-employ doctors?
Well, firstly, we've trained so many doctors because the country needs them. And so once they are trained, qualified, and registered, we would like them to be back in service. So the challenge that we have to face is the fact that because of the financial situation, we have to reprioritize. So in other words, we go into our own programs, close down some of the programs, and prioritize professional staff so that they will be available to offer the service. We want to make sure that we resolve the problem of unfilled vacancies. We want to resolve the problem of shortage of staff. We want to make sure that our people find enough doctors, so that for purposes of attending hospitals and clinics, there should not be long queues, and there should be good care given to our people. This is the basis on which we're going to transform the health services to create a platform for national health insurance to be able to be implemented in the country. So I just want to assure again that we're doing everything between myself and the Minister of Treasury to find the resources that will place the doctors in position. We need them to be patient, because the processes, the back office work does not seem very much if you are, working in the hospital. But in reality, a lot of work has to be done in verifying the posts and redistributing the posts and actually making sure that there's a balance in terms of where the doctors are needed and where they're available. So doctors may be available in a province that need them less than the ones that they've not been working in. Some of the rural hospitals need a lot of people to come and work there. So when we say that the posts are available, they may be anywhere in the country, but still we need the doctors. They must not feel that they're being neglected. They want to assure them that we'll do everything to make sure that they're placed. They must just be a bit patient with our system.
And Dr. Mkhize, as much as the South African public and the doctors want to be reassured, the reality remains that South Africa has finite resources in terms of funding. Funding isn't just going to suddenly become available. What has Treasury said in terms of where that money will be found?
Well, Treasury is really under serious constraints. I'm a member of the Minister's Budget Committee, MINCOMBAT. It's a real tough situation because we all are aware that the country is going through a very tight fiscal position. And on that basis, we have to sit down, rationalize, change, reprioritize, shift resources from one area to the other. And I want to say that Treasury and the Minister are doing everything they can. I think for the Minister, when they are announced next year, they'll have indicated a number of steps that have been taken to shift some of the funds to priority areas. But there are areas which we have to protect. We have to protect the poor. We have to protect the services which are direct to our people, the community services, the health services, the education, the social development. We've also got to protect the investment into infrastructure that will stimulate further growth and more opportunities for our economy to expand. So the Minister is doing a lot of work at that level. We'll simply just reprioritize and then cut down what we think can be delayed, because at this point, the reprioritization is going to be the name of the game.
Dr. Mkhize, very quickly, can you tell us which other provinces are facing similar situations?
Well, all the provinces have got the similar challenges. I had an emergency meeting on a teleconference last week, and I've also been over this weekend going through a number of discussions, verifying figures. Eastern Cape is one of those that's going through a challenge. KwaZulu-Natal, Northern Cape, literally all the provinces are going through a serious shortage of doctors. Gauteng and Western Cape might be slightly different in that they might actually be seeking to release more posts, and some of the people they have may not necessarily all be applying for their posts, but most of the provinces are facing a pretty much similar situation. In all, we have calculated that we have got 900 community service doctors that we want to place into positions for the early part of next year. That's our priority. But we have, as I said, already placed another 1,300 community service doctors. We've already placed 2,300 interns, and that's a drastic increase from last year. Last year, we had about 1,300 or so. This year, we had to place an additional 847 interns. So we are expanding the services at the same time, but you are right, there are constraints in terms of resources. Just that as a government, we have to keep rationalizing, reprioritizing. We will be able to place those doctors. I would like them to, be patient with the system.
Thank you very much. Health Minister Dr. Zweli Mkhize telling us there about a looming crisis in the medical sector where doctors do not have enough funding for community service doctors and nurses in various provinces across the country.